Hello, this is Laurens Holve of Laurens Holve Healthcare. This is a brief talk to talk about the 5 most common causes of knee pain that come or visit me in my surgery. Knee pain, of course, is one of the big disablements. Stops you from running, cycling to work, and can cause quite a lot of distress to a lot of people. So let's begin with one of the most common ones, osteoarthritis of the knee. This tends to happen certainly past 30 or 40 years old. It's due to degeneration of the actual cartilage. So the cartilage we're talking about is the one that caps the bony ends of either the femur and the tibia. So the long bone of the femur and the one that it sits on. And what happens is that it wears down, crumbles, and causes inflammation. You've probably all seen those knees that sort of swell up and become a bit distended, swollen. The person is unable to sometimes fully extend it, causes pain on walking, especially, walking up and down stairs. Running is curtailed. And very often swelling accompanies it. So it's quite a distended joint and can cause a lot of problem. And these ones are easily treated. Hang on for the next video where I will talk a bit more about, sort of treatments that can be done, but it can be managed. So osteoarthritis is not the death knell of your knee. That's one of the most common ones. The other very common, it's more like an injury, and that's what's called a meniscal tear. Menisci are what are called semilunar cartilage, for simple reason they're sort of crescent shape. And you've got one on each side of the knee, the medial side and the lateral side, or the inside and the outside. The inside one, what's called the medial cartilage, is much more easily torn than the outside for the simple reason it's a bit more mobile. And certainly when the person is young, you often see it in footballers and people like that. And it's a fixed, the leg is fixed and there's a twist on it. And that can tear that, what's called the meniscus or the cartilage. Not the cartilage we talked about earlier on, but this is the little bit that lies between the knee joint. It's a bit like a washer. It disperses forces. So these can get torn when you're younger, and it can be quite severe in what's called a bucket handle tear. It sort of flips up and it gets in the way of the joint, and the joint or the knee joint completely locks up, unable to use it, and the person can't extend their knee. In those bucket handle tears, almost certainly surgery will be needed to clear it off because nothing else will remove it. And the person, the joint is unusable. As you get older, like everything else, as you get older, it degenerates, I'm afraid. And so you get it fraying, so they can split a bit. And this is, you can get it without injury. It just starts. People complain about pain, usually on the inside, the medial cartilage gets frayed. But again, it causes swelling and difficulty or painful movement. The good news with these is that usually they settle down. So treatment really does help a person get back to what they want to do, whether it's even running, swimming, whatever the person wants to do, it does settle down. And treatment really expedites the person getting back to normal. So it's certainly a good idea to have that treated. So those are the sort of menisci. The other very common condition, ligament strain. So you've got the medial ligaments on the inside and the lateral ligaments, and you've also got what are called the cruciate ligaments. So the more common one, and ones that you can recover from, are the medial and lateral ligament, where you sort of twist your knee. The knee, you have got several grades of ligament strain, where you get some fibers torn. You cause a little bit of side swelling and a lot of tenderness on the side of the knee. Very sometimes difficult to distinguish between that and meniscal tears, but usually you can flex your knee. The movement is not so painful, but it's just very painful on the side and may cause some instability. These are quite easily treatable and rarely require surgery. The only surgery is only required if they are actually torn, because obviously you can't do anything with that. The cruciate ligaments tend to be more serious. These are, you've got what's called the anterior or the front ligament and the posterior cruciate ligament on the back. Common injury in football, rugby, skiing, usually more athletic because it does involve force. So typically a person's foot is firmly flexed and there's a twist and the ligament ruptures. If it's a partial tear and the person, is, let's say, not quite so young anymore, 30, 40, you can sometimes leave those alone if there's not too much instability. And if you build up the muscles, person can live with that. However, if it's too loose in there, you often need surgery for the simple reason. If there's too much movement between the joints, the knee moves back and forth and you wear out the cartilage, so you're more prone to osteoarthritis. So almost certainly then you'll need surgery. The problem with the surgery, it takes about 6 months to recover. So, so it's not something that you want unless, you absolutely need it. But certainly if it's torn, there is no choice. So those are the anterior and posterior cruciate ligaments, which basically it tends to be more surgical. But if a person, if it's quite minor, you can certainly rehabilitate people so they can go back to fairly normal activity. So it's not all bad news. The fourth one is Basitis. And this is when you get swelling, usually on the top of the knee, usually a result of a bang on the knee, from kneeling too much, or sometimes people get it spontaneously. And it's not osteoarthritis, it's a water pocket, which is basically a bursa is something that lies between muscle planes and it reduces friction and they can become inflamed and the whole knee completely flares up. But usually the movement of the knee below isn't painful. There's no painful on the sides of the knee, and so you can see the bursitis. It used to be called housemaid's knee because it came when there was in the olden days when people were scrubbing floors and kneeling on their knees, and that would irritate the bursa and would swell up. So perhaps people are doing less of that, so people are getting it from different activities, but it's still quite prominent. I see quite a lot of it, and certainly treatment helps reduce it. And if you do have housemaid's knee, the first thing to do is put some ice on it just to try to help reduce swelling, because it will restrict backward movement or flexion of the knee simply because the water pocket gets in the way. It's not terribly painful, but the thing to watch out for, they can become infected and then they're hot, red hot swelling, and then they are painful and you need to then be on antibiotics. And I think now we're on to number 5, and the other common condition is pain on the back of the knee, sometimes called chondromalacia patella. When I say the back of the knee, I mean the back of the kneecap, I should say. And this is a softening of the cartilage on the back, very often manifested by walking downstairs because of all the pressure going to the back of the knee. And this can be, again, quite painful. Certainly stops a person running downhill because of the pain, causes swelling. And this is quite readily treatable. If it's terribly bad, sometimes surgery is needed to scrape the back of the knee to take off some of the some of the cartilage, which might be uneven, but that's really done, and certainly treatment helps it. So those are the 5 main conditions I see in my clinic. Any questions, email me, tick a like because that helps me, and if you want any more like this or tell me some subjects to do, I will do them. Thanks for watching, and hope to see you when I will talk about treatment of these conditions. So hold on.